again, thank you for making time from a busy schedule for
Thank you so
being a
much.
part. Yeah.
Yes.
So next we will move to Dr. Atharva. Dr. Atharva, are you here? Dr. Atharva? Okay, I think he's some issues with the network. So we'll move to Dr. Ramit then. Dr. Ramit, are you here?
Good evening. Yes, ma'am. I'm.
Dr. Atharva, are you here?
Yes, ma'am.
Yeah. Yes, Dr. Atharva, can you introduce yourself?
Ma'am, I am Dr. Atarwa Pandreand. I am currently doing my DM residency at PGI Chandigarh. I am in my first sem currently.
Okay. I think you're the first resident in PJ, right, Dr. Atharva?
No, I am the second resident. I have one senior.
Okay. Okay. So could you just briefly tell why did you choose ID and what was your rank through? So you went to the INISS. So what was your rank in that and like why did you choose ID and why PGI? Yeah, just briefly.
Ma'am, why ID? I had done my residency in Northeast in Tripura. So we used to get a lot of HIV patients, infective endocarditis. So that helped me to grow interest in the field. After passing my MD, I did an observership for 15 days with Parikshit Prayag sir. That further strengthened my interest in infectious disease. Then I had a rank 2 in INISS last December session. And why PGI? That is a controversial thing.
Okay. So how are you finding it? So what is your daily routine as an ID resident, first year ID resident in PGI?
Daily routine is, ma'am, we reach generally by 8 a.m. 8 to 9 is common academics, including for medicine residents and other senior residents from other departments also join nephrology, etc., neurology, nephrology. There is a staff CPC, student CPC, staff clinical meet and student clinical meet. So we attend that. From 9 our daily routine rounds start. Ma'am, am I audible?
Yes, please. Continue. You're audible, Dr. Atharva.
From 9, we are in the ward. We have some primary patients and then referrals are also there. So seeing those things and has academics also going on some days twice, some days thrice. So it is usual timing is 8 a.m. to almost 8:30, 8, at least 8 p.m. Some days 9, some days it goes on to 10. Depends on the number of referrals, ma'am.
Okay. So yeah, that's. So do you have night duty? So are the medicine residents you're posted under medicine only, right? Or you have separate division?
Ma'am, here medicine department has 2 units. Unit 1 sees infectious diseases and Unit 2 sees rheumatology. So,
Okay.
So it is under medicine department only, but predominantly we get only ID cases.
Okay, sure.
Medicine residents are posted night duty once a month in emergency. We are posted in once a month in emergency.
Okay, thank you, Dr. Atharva, for sharing your insights. I think that would have helped many people to understand what they have to undergo. Yeah, thank you, Dr. Atharva. I think you're on duty as well, right?
Yes, ma'am.
Yeah, yeah. Take care.
Thank you.
So next, we have Dr. Ramit. Do we have Dr. Ramit? Yeah. Just why are you not able to mute? Okay. Can you just try again, Dr. Ramit? Now I will just see if I can. Can you try now, Ramit? Dr. Ramit? Okay, we will move to the next person. Dr. Ashok, are you here?
Hello, madam. Are you able to hear me?
Yes. Yes, yes. So, Dr. Ashok, would you like to please introduce yourself?
Madam. So myself, Dr. Ashok, I am doing my DM Virology second year at the Government Tirunelveli Medical College and Hospital. And I'm very happy to see Dr. Akshatha, madam. And it was 2021 when we gave our DNB final practicals during the mid of COVID Delta wave. And it was a challenging exam.
Yes, yes. So, yes, Dr. Ashok, I think many would be interested. So, tell us about your experience in DM Viro. So, why did you choose DM Viro
Okay,
in
ma'am.
the
So I
first
was
place?
giving, I was preparing for DM infectious disease entrance exam actually, but it was quite competitive. So I was appearing for both NEET SS as well as INASS. And at a particular point of time, like in the third attempt, I got a good rank in NEET SS and I returned to DM virology. And during my MD period, like I had a lot of interest in counseling HIV patients and work in virology laboratory, especially HIV laboratory, madam. And here like our work usually starts at 8 in the morning and till 4 and sometime it can extend till 6 or 7. So during the first year, like we are posted in the lab like cell culture lab, molecular lab and viral serology lab where we perform various viral assays like hemagglutination test, and we do a lot of cell line testing, and we inoculate virus onto the cell line, and we look for the cytopathic effect. And in molecular diagnostics, like we do a lot of PCR and we troubleshoot a lot of things. And we also go for central diagnostic laboratory where we handle viral serology for various viral infections. And we have peripheral posting in CMC Vellore Clinical Virology Department for around 3 weeks, and we go for National Institute of Health Delhi and Hafkin Institute in Mumbai. So during the first year, like we go for these peripheral posting. And in second year, like it starts with the 3 week posting in NIV Pune, that is for 3 weeks. After that, like we are posted in the wards and ICU. So first we start with the IMCU, then emergency, then triage, Then we are posted in super specialty departments like nephrology, transfusion medicine, neurology, dermatology, venereology, ophthalmology, medical oncology, and medical gastroenterology in rotation. And we also get trained in histopathology, so that like we will be able to diagnose various histopathological findings like any viral inclusion bodies and rabies. So those kind of things like we'll be able to see. And in third year, like we go for National AIDS Research Institute in Pune, and we also go to NIMHANS in Bangalore. And after that, like again, like we will be posted in the virology department where we will be doing our dissertation work. So here, like we have an dissertation where we need to select a topic and we need to work on it. And so there will be a lot of peripheral postings to go, madam. And in second year, like it will be full of clinical posting where we will be seeing cases, and it will be a little hectic in the second year.
Yes. So tell us like common what do you think were your like preparation? How did you prepare for the exam, and like what and all did you read? So as you have mentioned, you prepared for both ID as well as
Yes, madam.
Viro. So tell me, like, could you just elaborate like how did you prepare and how long did you prepare for this such exams?
Okay, madam. So it was my third attempt where I entered NEET ISS DM Virology. So the actual syllabus for NEET SS DM Virology will be the core of microbiology. So many will be the practical oriented microbiological aspects coming from various vaccination guideline and various serological diagnosis and various even bacteriological diagnosis, like which will be usually unusual cases they will be giving, and we will be picking up a certain option. The thing will be like the options which they provide will be like moreover looking same. So it will be little difficult to, and the first time wrong I did is that like I did not go through the CLSA guideline and went, and many of the questions were from CLSA guideline. And the second time, like again, like I did little mistakes. And the third time, like I went with the full preparation, and it was really a good attempt. And many questions will be asked from vaccination, recent immunization guideline, and recent antibiotic stewardship things. So those kind of things they will be asking in the NEET examination, madam. So NEET super specialty DM virology, like it will be only for the microbiology, MD or DNB microbiology. So the competition level when compared to INASS, like it is a little low. For INASS, like I felt very difficult with the other clinical subjects like medicine or pediatric question which they ask in the exam. So microbiology part, like it will be easy, but in my point, I felt very difficult with the other aspects like medicine and pediatrics, which was very difficult for me to clear the particular questions pertaining to those subject.
Okay.
And here DM virology, like it will be full of microbiology. All the 150 questions will be from microbiology.
Okay, okay. That's wonderful. That's wonderful to hear about DM virology. And so what do you think, like further, what is your plan? So where do you see yourself in the future?
Okay, madam. So actually, it is a new department, madam. So actually, like we have totally 3 colleges. So now the course have been started in AIMS Rishikesh with 1 seat, and we have total 4 seats in CMC Vellore 2 seat, and Tirunelveli Medical College 2 seat. So actually, like we can go to the central institutes in the future, like National Institute of Virology or National AIDS Research Institute, like we can go. And in case if you are going to go out of this particular PG course, like we are the people like who will be starting the course in various other institutes, madam. So it's been
Yes.
only 5 years since the course have been started.
So yes, definitely. I think there's a lot of scope, especially I think with COVID we have seen like obviously there will be a lot of the emerging infections are going to be viral, and definitely it has a good future, I would say. So thank you, Dr. Ashok, for making time for being a part of this. Thank you once
Thank you,
again.
madam.
Yes.
Hello, ma'am. I just want to know what is the dissertation project Dr. Ashok is working.
Yeah, Dr. Ashok, could you like to answer?
Yeah, madam. So basically, I'm working on hepatitis B. So where like we are looking for certain mutants. Like actually, I'm looking for the anti-HBs AG in chronic hepatitis B. So we all know, like in hepatitis B, like there will be the presence of HBs AG, but not anti-HBs. In case of the anti-HBs is going to develop, then the HBs AG has to disappear because they will neutralize it. But we have seen few patients where the particular patients were having both HBsAg and anti-HBsAg in high titer. So it means that like we might be dealing with a certain mutants. So this particular mutant cannot be neutralized by the vaccine induced immunity. In case if you are going to handle those kind of patients in future, even if I am vaccinated, like if I'm going to get that particular strain inside me, I'm going to get infected. So right now, like I'm looking for those strain and I'm going to go for sequencing to find the mutations.
Okay.
And
That's
and I'm also working on other things like HIV co-infection, like HIV 1 and 2 co-infections, which we seen in a few patients. And we also doing certain studies and cell culture related workup in herpes simplex virus.
no, that's wonderful. So are you seeing HIV-2 cases?
Yeah, madam,
I
we are
like.
seeing.
Okay.
Even like past week, like we have seen a patient with a CD4 count of 250, and the patient is a known case of HIV-1. And when we did the viral load, it came target not detected for HIV-1. But unfortunately, again, like we are not supposed to do antibody testing again, but still, like we did so for our confirmation. So the antibody came positive for both 1 and 2 by card method. Again, like we have sent the sample for reference institute to find out the HIV-2 viral load. Are we dealing with, if in case, if the patient is going to have HIV-2, I will be again doing the sequence and I'll be finding out certain mutation. And in case if I want, like we can change the antiviral combination which the patient is taking, because the patient is adherent to the particular treatment, but still the patient CD4 count is low.
Okay, okay. But currently the same should work, but maybe I think you will give
Yeah,
new
madam.
insight.
Because
Yeah.
dolutegravir combination is used now, it has to work, but we doesn't know whether we are dealing with any mutant.
Yeah, yes, I agree. Thank you, Dr. Ashok, for this. So next we'll move to Dr. Ramit. Are you available, Dr. Ramit? Okay, I think some connection issues. Okay, so we'll just message him. Dr. Harsha. Hi, Dr. Harsha. Would you like to talk? Please
Yeah,
introduce
sure,
yourself.
ma'am. Hi, everyone. I'm Dr. Harsha. I finished my MD General Medicine from Nizam's Institute of Medical Sciences, Hyderabad. And later, I worked as a senior resident in Infectious Diseases Department of Apollo Jubilee Hills in Hyderabad. So it is the only one department in Hyderabad which was existing when I finished my MD medicine. So I liked infectious diseases with that 9 month senior residency which I did. So I pursued further DM infectious diseases through NEET SS in KMC Manipal. And recently, 10 days ago, I finished my DM and I am joining as a consultant in Hyderabad.
Okay, nice. So tell us what motivated you to take KMC Manipal. Like I'm sure you had other options, including the INISS, and obviously KMC Manipal, it has the private, so you'll have a lot of fees, which is there. So compared to the government, so why did you go for a private medical college, and what was your experience in that?
Yeah, sure, ma'am. So I was actually considering AIMS New Delhi, ma'am. At that time, SGPGI and PGI Chandigarh are not offering the courses. I have given this AIMS entrance, which was ID specific exam that we have to give. And within a 6 month interval, I have given it twice. So the two times the result was no student is qualified, and that particular 2 times which where I have given the entrance, no student qualified and there was no intake by AIMS New Delhi. So I don't want to wait further and I have given NEET SS. So in NEET SS I scored a rank of 10. The options for infectious diseases at that time was CMC Vellore, KMC Manipal, Kottayam Medical College in Kerala, and School of Tropical Medicine, Kolkata. So my subsequent batch, I think IPGMER Kolkata has also started seats. So when I joined, only the 4 institutes were actually offering the course. So my colleagues, my parallel colleagues who scored rank 1 and 2, they secured the seats in CMC Vellore. So I had to choose between the Kerala, Kolkata, and KMC Manipal. So all places the department is started, fresh departments are started, and one more thing is KMC Manipal is one of the top 10 medical colleges in India always. So it is providing quality medical education from 1953. So there is a track record of KMC Manipal, and lot of my seniors who finished infectious diseases course at Apollo Jubilee Hills, they are from KMC. So a lot of them gave an insight of KMC and the academics that can happen in KMC. They all pushed me for KMC. That is one reason. And also, uh, the two states, Kerala and Kottayam, are having a 2 or 3 years bond. The Kerala is having 2 years bond, whereas Kolkata was having 3 years bond. To break the bond, it is almost 20 to 30 lakhs. So the same amount can be paid in fees for KMC Manipal. It's around 8 lakhs a year. So total fees accounts to 24 lakhs. So I thought instead of paying the bond amount, let me finish in KMC Manipal, and the department is huge. After CMC Vellore, 6 faculty are there in KMC Manipal. After CMC Vellore, this is the largest department which is providing DM course. So I selected KMC Manipal. I'm happy for that. I finished the course.
Yes, thank you, Dr. Harsha. So, like, so tell us, what did you wish you knew before joining the DM? If you think there is something you want to share for any future aspirants, so about the DM ID or the course, or where they should choose, what exam they should take, anything, any takeaway points you would like to add, say.
I think for the entrance point of view, Harrison's textbook, Principles of Internal Medicine, the ID part, which is there in Harrison's, if the students finish it, all the total infectious diseases part in Harrison, they can easily crack even INSET SS. That's what I feel. A little bit careful reading of all the ID chapters in Harrison's, that is good enough to crack even INSET exam. So coming from the microbiology background, since microbiology residents are also eligible for NEET SS and INSET SS, maybe they have to more read the clinical stuff also now. INSET, it's more of microbiology based, but whereas NEET SS, there are going to be a lot of clinical questions for which they need to go to the PG preparatory notes of medicine, which we did in NEET PG. That is going to help. And there is one book called guide, MCQ guidebook by Dr. Apurva Shastri from JIPMA. So that book is also going to help a lot. We can easily remember some things, a mnemonic type of remembrance we can do for the sake of the exam.
Okay, thank you, Dr. Harsha. Thank you for sharing your insights. With that, we'll move to Dr. Ramit now.
Am I audible now?
Yes, Dr. Ramit.
Thank
so, would you want to introduce yourself? I think before that, I would say he is rank 1 in the microbiology stream. So, and he is interested in taking DM Virology. So, over to you, Dr. Ramit. Please introduce yourself.
Okay. Here, actually, good evening, everyone. So, I'm actually Dr. Ramit. Here I am an SR actually currently at KMC Manipal in the Department of Microbiology. So I have actually finished my MBBS and my MD in actually microbiology. So I'm actually JIPMAR Puducherry. And ultimately I'm actually planning to actually join the DM Virology course in CMC Vellore. So yeah.
So Dr. Ramit, would you like to elaborate on what was your preparation strategy? Like, it's an excellent, number 1. So yes, tell us more about your preparation strategy.
To be honest, so here I cannot actually suggest my preparation strategy to almost everyone. So here actually, but as actually here Ashok pointed out, So having some of my actually basic actually concepts in virology straight, such as so here upon the what can I say? So here upon the what can I say? The structure and actually pathogenesis of actually different actually viral infections, and upon the actually guidelines with respect to actually certain actually viral infections, and the actually immunization guidelines and schedules also help a lot. So however, in actually this exam, so they hadn't actually focused extremely on the actual immunization guidelines per se, to be honest, in this exam. So, and apart from having your concept straight and having a good actually preparation duration, so it also helps to actually participate in some of these actually online grant tests which are available. So under actually some of the courses such as speed and actually prep ladder as well. Mainly I had applied for the actually speed online actually grant tests towards the ending. So that helped me to here optimize my response time to certain questions. So yeah.
Thank you. So, what are your expectations of the course, Dr. Ramit? So, you were said you want to join at CMC Vellore. So, have you
Yes.
spoken to any of the seniors there, and what do you think? How is it? What is your expectations from this course?
Yes. So I have already spoken to some of my seniors there. So I actually have one of my MD seniors who has actually recently passed a DM Virology in CMC Vellore. So here I am expecting a good, basically, so here all-round exposure to the actually different aspects of actually diagnostic virology, and as well as the management of actually viral infections per se. So as MD microbiologists, so here we usually do have a good exposure to the diagnostic aspect. So if you are from a central institute and if we have an affiliated actually virology lab, so we usually have a good exposure to the diagnostic aspects. However, so actually what I personally feel is that our exposure to the treatment aspects actually, so here it's lacking in a way. So here I expect the actually DM virology actually course to actually bolster this.
Yes, I mean, I think you're the right candidate for it. So, he is the one to just to inform. He is the one who would come to our rounds as well and is always interested. And whenever we want anything we want to discuss, we always call him. So, Dr. Amit, so where do you see yourself in the future? So, what is your like after this? Like, are you going to move towards the research field, or what do you think? Where do you want to see yourself in the next few years, next 5 years, let's say?
Okay. So here at this point, I'm actually taking it one step at a time. So as actually virology is an emerging field, so it's a bit actually difficult to answer this question. So however, I'm actually primarily interested in research. So actually clinical research per se. So I am, so here actually to be honest, so here I am actually interested in the actually vaccine development against some of these respiratory viral infections. So that is one of, so here actually one among my interest, and in the development of a universal influenza vaccine. So that is another area which I'm hugely interested in. So I am actually interested in what can I say?
Yes, sir. So I
So
think
here,
you're one of few persons who are actually interested in research. Like most of us, like you feel, they feel that research is forced upon themselves. But I think research is also one thing which is equally important as your clinics. So also, Dr. Amit, would you add just like why CMC over others? I think Dr. Ashok did mention there are 2 or 3 more which has a DM Viro course. So any particular reason why you're choosing CMC Vellore?
yeah. So here actually there are several other actually institutes which are offering the actually DM virology course. So however, so compared to them, so actually what I felt was CMC was one of the actually first institutes to start this course. So they have a well-established actually course underway. And apart from that, so actually there is also ILBS Delhi. So that is also a pretty excellent institution as far as what I'm aware of. So however, so actually what I felt is So here, see, KMC offers a more actually balanced environment actually with respect to the actually different actually viruses or the options where you can actually, so here conduct your research or your studies on. So here ILBS Delhi is a bit actually focused upon your hepatovirology and your transplant virology. So if you are interested in those, it is an excellent institute for that. So however, if you are interested in some of the other viruses like me, so then the respiratory viruses, so I felt actually CMC would be a better institution to gain exposure of these.
Okay, thank you. Thank you, Dr. Ramit, for sharing your insights. I think you clarified many doubts which may be running through people's mind when they want to choose DM Viro. I think even I have learned a lot about this now. Thank you. Thank you once again, Dr. Ramit.
Thank you.
So is there any questions the audience want to ask any of the panelists or me? You can just unmute yourself or you can put it in the Q&A section. Or maybe share the feedback about the session. What did you like? What did you not like?
So very happy to see Dr. Ramit Kundu joining as our colleague in virology, clinical virology.
Yes, sir. Yes, sir. Thank you. Anyone else?
Thank you, sir.
Good evening, ma'am.
Yes. Dr. Yash.
Actually, I have a question. Coming from a microbiology background, how should we prepare for medical group of NEET SS?
Okay. So as you all know, the NEET SS now, the pattern is medical group as well as surgical group. These are the broader sections. So medical group will have necessarily all the medicine based questions, which is common. It's not based on the brand specific now. So definitely take a NEET SS medical stream, any of the study this one like speed or you can take from the dams or Bhatia, whatever, whichever. You need to take a coaching which has exposure to the medical stream, NEET SS medical stream. So and in a way it is more simplified because you don't have to read specifically read medicine as well as micro and go reading infectious diseases. So it is in a way it is simpler and again it is a common ranking system. So so you'll have to give definitely you are competing against the medicine counterpart in an entrance exam which is more focused on the medicine aspects. But again and other thing I would say is it is not very complicated. It will be the basics of the medicine with added, and also it will have broader specialties including your nephro questions, uro questions, the gastro questions, etc. So I would say at least you should start 1 year to 2 years prior, take up any of these and give as many entrance exams so that you have an idea about the type of questions and which you can concentrate on. And I think after this exam, we'll be more able to comment because this is the first session where Micro will be giving this exam. So maybe we'll have better idea about this, about the scenario, like what is the usual rank distribution and the with a micro background, how are people faring. So I did have one more speaker with whom I had planned to get him. So he is a micro background has given this NEET SS and his Viro DM he gave in both micro as well as medical stream. In micro, his rank was 6 and that is for virology. And under the medical stream, his rank is around 1200, but he couldn't join. So I think the important takeaway would be take any of the coaching, and definitely Harrison is the thing which they do concentrate on. So I think you need to so any the sessions or the classes will help you in making Harrison simpler. So I think that is what you need to target currently. And further going in so this one you don't consider as like okay I took micro, now I have to read medicine. Don't consider like that. But I think that knowledge what you read will help you in further your in your residency program, which after if you join as a DM ID resident, that is definitely required. So you consider it as a pre-preparation for your residency, because you are not going to manage just the patient, just the micro part, or just the cultures, or your this one. So you are going to manage a patient as a whole. So you consider this as a revision exercise for yourself to like reread whatever you had learned. It's not like you never learned about medicine. You have finished your MBBS, you would have given. So it is like relearning that. So I think you need to take up this coaching for at least 1 year, I would say. Start early.
Thank you so much, ma'am.
Yes. Any other questions? Anyone else? Okay, I don't see any questions. So if there are no questions, we will just end this session now. Thank you all of you for joining this. I hope it was useful in some or the other way. And again, I would like to thank all the panelists for joining. Dr. Harsha, Dr. Ramit, Dr. Ashok, Dr. Atharva, Dr. Sandeep, and making time from their busy schedule to be a part of this. So have a good night. Thank you. Thank you again.
Thank you, madam.